Welcome to the Sesame Street Unified School District. Today I'm presenting a policy to address employee wellness in the district at the elementary school level, but technically the policy and programs presented can be applied to primary and secondary schools as well. Here's some basic information to introduce you to the fictional Sesame Street Unified School District. First things first, everything you see here is based on Los Angeles. As of 2022, more than 275,000 students were in kindergarten through the 6th grade. Believe it or not, the students and their families speak 97 languages. As you can see, Sesame Street is quite the melting pot of cultures. SSUSD is not only the second largest school district in the U.S., but also the second largest employer in Los Angeles. That is a lot of employees who need wellness policies and programming. We've learned a great deal about student health, wellness, and nutrition education and policies for students. But what about employee wellness needs? They need structure, security, and attention too. Well, let's look at the federal guidelines for employee wellness. The National Association of State Boards of Education, NASB, has categorized employee wellness into 8 sub-target areas. Among those listed here, California only encourages, not mandates, having a policy for general staff wellness. According to the whole school, whole child, whole community model known as WISC, the key to moving from model to action is the collaborative development of local school policies, processes, and practices. So a comprehensive wellness policy for employees must include a combination of strategies, programs, and benefits that tend to physical and mental health concerns. The Healthy School Community Model places the principal in a leading role in affecting health changes. Research indicates that if the principal leads or co-leads, then programs are more sustainable. Now, as we look at district guidelines, well, we find there are none. So we will create one bearing in mind that putting a policy in place will reduce absenteeism and employee turnover, increase productivity, promote strong mental health, make proper nutrition and physical activity more accessible, reward staff for their work, and create an overall happier environment. You know that old saying, happy wife, happy life? A similar comparison can be made here. Staff wellness improves the school environment for children. Before making a policy, we need to assess what is needed. We will do so using the CDC Worksite Health Scorecard to determine which programs to implement under the employee wellness policy. Next, we will develop programs and activities in physical activity, mental health, and nutrition to address gaps in the scorecard uncovered. Afterwards, we will begin the implementation, and finally, every 6 months, we will conduct an evaluation to determine strengths and weaknesses in the program. To promote active lifestyles, we will create at least 3 opportunities to participate in physical activity classes or weekly events. We may partner with Pilates and martial arts studios and gyms to get classes designed just for our staff, or discounts on classes and membership. We will also ensure as many of our school gyms in the district as possible can accommodate the needs of staff. Employees can potentially use the gyms and resources of other schools as well. We can start groups or clubs that walk, hike, jog, or bike together, softball and sports teams, and more. The assessment will determine which activities are best. For mental health, we will arrange for accessible services to manage stress, anxiety, and depression. Programs may include a 24/7 help hotline, yoga and meditation classes, and access to a counselor paid for by insurance whenever anyone needs or wants to talk to someone. We also must ensure people take breaks and practice NEAT, movements to clear their minds and breathe some fresh air. Group outings and activities will also be planned to promote special social bonding to relieve stress and loneliness. Furthermore, group activities that are fun and allow for bonding, like bowling, family picnics, and wellness retreats, are some other possible ideas. Nutrition programs are also essential in this program development. We will support healthy eating by providing free, nutritious school meals during working hours and stock the lounge with smart snacks and spa water, arranging for discount vouchers at healthy eateries and grocery stores, and providing informational webinars, brochures, reading material on nutrition and chronic disease, access to school garden, and more will also be considered. Everyone is a stakeholder, but those at the top are the staff. They will benefit the most if they participate. The District Employee Wellness Director, or the DUDE, and the individual point people at each school also have a huge stake, as the program's success partially depends on how well they can coordinate activities, encourage participation, raise necessary funds for programming, and build relationships with local partners. The principal, as the face of the school, is most likely to be able to garner the most support, as the healthy school community model has proven. The local partners also have a lot to gain: exposure, new clientele, and profits, even if they provide a discount to the school district for bulk enrollment in their yoga, Pilates, and physical exercise and activity sessions. If the DUDE can ensure insurance companies cover mental, physical, and emotional health appointments for school employees, the providers will guarantee income and more clients. And of course, we cannot forget the students. They will have a much better campus experience if staff are happy and healthy. One barrier is financial. However, these activities don't have to be expensive. We have hundreds of schools in the district, so we can pool our resources. We can think out of the box and find people among us who specialize in certain activities to be the providers if we cannot afford the services of gyms and Pilates studios, for example. We can utilize the PTA in fundraising for staff appreciation and wellness activities. We can conduct activities outside in nature to save money as well. We will need funds to hire someone at the district level to enforce this policy, and who will coordinate with principals and a potential new hire at schools for the coordination at the local level. Whether or not these activities can be executed will depend on the principal and supporting staff. They say that part of the success of the program is dependent on the emotional wellness, or the emotional intelligence of the school principal. Those with strong emotional intelligence inspire enthusiasm and optimism and less frustration among employees. So in conclusion, we need one district leader, school principals, and a designated staff member at each or most schools to implement the policy, conduct the assessment, develop, coordinate, and launch the activities. If schools collaborate, we can keep costs low and pool resources. The more partners involved, the better the offerings for staff, and the more likely there will be something for everyone. Finally, the district director will oversee evaluations to see how everything is going and if any changes need to be made. Thank you for tuning into this episode of the Sesame Street Wellness Policy. In this slide and the next are our resources.